When your hormones are working against you, no diet seems to help. Hi, I'm Dr. Nina. I am a functional medicine doctor, and I help women with hair loss, hormone restoration, as well as weight loss. It says, we're seeing so many women struggling with weight despite doing everything right. Could you break down how conditions like PCOS, thyroid issues, and menopause actually hijack our metabolism? What patterns are you seeing in your practice? Okay, so this is really good because you're talking to someone that can give you expert advice, as well as someone who actually experienced some of these issues myself. So, when I'm going to start off with PCOS. So when a woman has PCOS, especially if though her androgen hormones are high, we're talking about high testosterone levels or high DHEA, or she's had an ultrasound and it's been confirmed that way that, okay, so she is a classic case of someone that has PCOS. When these metrics are high, what tends to happen is at the same time, it drives your insulin level up for some reason. So the insulin goes up, and the insulin is the cause of you having an issue as far as losing weight. But now, I don't know if you guys remember what I said in another video, is that when you have PCOS, there's other things too that you need to look at. So mainstream medicine for women that have PCOS, one of the first things that they'll do is they'll put you on a birth control, like a progestin birth control. But the thing is with a synthetic birth control, especially progestin, is that the body thinks that it's estrogen. So it's not a true natural progesterone, which can actually be beneficial for someone that has PCOS. Because why? Progesterone can help with the inflammation. There's other things that you can do, that you can give a woman, like certain B vitamins that can actually help. And as well as if the insulin levels is high, of course, we all know that the GLP-1 works, berberine works. There's different types of holistic approaches that you can take. So thyroid, the same thing. So if your thyroid is not working properly, and if your thyroid is too high or too low, like I said before, you can either gain weight or you can lose weight, right? So in my case, I was actually gaining weight. And not only was I gaining weight, but I had thyroid imbalance. You're talking to someone that had endometriosis, and I still have endometriosis. A little bit of fibroids, they say, and polyps, right? So, okay, this is a lot going on especially for someone like me in this field, know exactly what I need to do to take care of my health, but I have all of these hormone imbalances. And the reason why women have so many hormonal issues, especially black women, is because we are exposed to so many things that can mess up the way that our hormonal system communicate with each other. If you guys have been following me, you know that I'm always talking about these endocrine disrupting chemicals that's found in foods, that's found in our beauty products, that's even in our, sanitary products, tampons, pads. I mean, they're everywhere. And I highly, highly, highly see that black women are very sensitive, and it appears as we are more sensitive to these chemicals than other ethnicities due to the type of hormonal imbalances and health issues that we face, especially the fibroids. Okay, so when you're experiencing menopause, right, when a woman goes through menopause, you can kind of look at menopause the same way how a young girl gets put on birth control, because certain birth control pills will suppress your estrogen and your progesterone levels. Suppressing your estrogen and progesterone levels is essentially almost the same thing that happens when you go through menopause. As you get older, those two hormones start dropping, estrogen and progesterone, and then what happens, your androgen hormones can start increasing. So weight gain can happen, weight gain around your belly. You can start having sleep issues. Also, brain fog. You can experience hair loss, constipation, anxiety, depression. These are some of the things that a lot of young women experience while they're taking birth control pills. So they, in a sense, it's like you're putting a young person through early stages of menopause. And then when you actually get off the birth control, what they don't tell you is that your hormones don't naturally modulate back to how they used to be before you were put on these synthetic hormones. Now, if we have all of these imbalances, right, from a hormonal perspective, and the struggles that we know that it's causing, especially if we're trying to lose weight. So we're trying to lose weight. We want to get some sleep. We're having some hair loss issues. We're having a little brain fog. All right, so proper testing needs to be done. So we want to do a full hormonal panel looking at how all of your hormones. We also want to take a look at your gut, the gut health too, and see, okay, what's happening with your gut as well. Taking a look at all this data, as well as I like to take a look at your nutrients too, because certain nutrients, especially your B vitamins and vitamin D and those type of things, can be very beneficial for hormones as well as your thyroid function too. So take a look and see how everything is converting, and then can put together a plan in place to start correcting these hormonal imbalances for each condition. So each scenario is going to be different. Someone that has PCOS will definitely be on a different hormone therapy plan compared to someone who is going through menopause, as well as someone who may have a thyroid condition. So each plan is different. But there's things that can be done holistically, just strictly dealing with nutraceuticals, or there are natural compounded hormones that it can help greatly for women that have these imbalances. If you look at my labs, I am not a classic clinical case for someone that have endometriosis, where they would say, she has high estrogen levels. Never had high estrogen levels. Estrogen levels have always been on the lower side. I do believe that my endometriosis was triggered by other things when I was younger, and things that I was given, such as a certain shot, without, having the knowledge of saying, hey, I don't want to take this shot. But anywho, but yes, if you're having hormonal imbalances, it can definitely put a toll on you if you're trying to lose weight. These things need to be balanced, and it's okay, women. It's okay to go through hormone replacement therapy, holistically with herbs, or seeing a hormone specialist. Why? Because your hormones is so vital for bone health. It helps protect your body from osteoporosis. It helps with your cognitive function. A lot of women start to experience brain fog. Your cardiovascular system, your immune system. It helps with regulating your insulin level to help with your A1C. So many things. So it's important. I feel like there's not a lot of education that's being done in certain fields, especially the field of gynecology. Gynecologists should be educating women more and letting them know that it's okay. There's a lot of studies that was done that spoke about estrogen, and a lot of those studies are outdated. They found that a lot of these studies were not factual. Read up on it about certain type of estrogen that was giving women cancer. It was the same estrogen, synthetic estrogen, that they give women that take birth control. Read through these studies very well, and always get a second opinion. But yes, this is what I've seen throughout the years. This is not new to me. I've been in the holistic space for 24 years and is very well versed when it comes to how different hormonal imbalances can affect the body, and having different types of hormone imbalances, what it can do for you as far as weight as well as mental health. So I hope this information was beneficial, guys. If you like, please like and subscribe.